And what we're particularly interested in GUIDE is not just a snapshot, but also the full context, what happened before and what will happen subsequently. So when we're thinking about child well-being indicators, we are very much concerned with historical context, which would explain how someone gets to where they are. And we're interested in what happens next. Hopefully there will be, can be policy interventions which will support and improve child well-being. And we would want to monitor those and see if policy interventions are having the effect that we would want them to have. How do we do this? Well, we can do this with surveys. Surveys, sample surveys, population surveys, where we can sample from the general population and using that information, make statistical estimations of particular experiences, and then see whether or not the interventions are working. So longitudinal data is regarded as high quality and amongst the best when it comes to understanding how policies are enacted and how policy interventions can improve people's lives. And longitudinal data has been used widely across Europe. And what this slide shows is a great many surveys across Europe, actually including the GLORY survey, which David mentioned earlier, which is a comparative study. But the point here is that many governments have already recognized the importance of longitudinal data when it comes to finding out about their populations. So that's already understood. The issue here, though, is that all of these surveys are asking different sorts of questions at different points in time and potentially using different sorts of methodologies. Now, scientists are interested in finding out about comparing one country to another to see if an intervention in one country can also work in another. And it's difficult to do that with these sorts of measures because they're not identical, they're not the same. So they have to go through a harmonization process. And so what GUIDE is planning to do is to do this harmonization from the outset. If we go back 10 years now, the Commission asked a question: is a Europe-wide longitudinal survey of child well-being desirable and feasible? And we looked at that call. And in our unit at that time, we had expertise in child well-being measures. We had experts in evidence-based policymaking, as well as in survey methodology. And we felt that by drawing together these three strands, we could make a good project and develop an approach to instituting a Europe-wide comparative longitudinal study of child well-being. So that's what we did. We put together the proposal and we began working on what is now GUIDE. We've always been working with academics, scientists across Europe, experts in child well-being, experts in survey research. But we've also been connecting with important NGOs as well. So we've always had a connection with Eurochild. We developed a connection with UNICEF very early. We connect with agencies as well, data collection agencies. So within the Coordinate project, which is funding this event today, we have got project partners from Ipsos, as well as from Kantar, who have been helping us understand ways in which we need to think about data collection for what we plan to do. As well as building the network there, we have been focusing on child-centric methods. So our project has always included a youth advisory board structure within each country. And we consult regularly children when it comes to the content of the questions that we're asking, as well as the way in which we're asking questions. So we do regard ourselves as a fully child-centric project. Within our projects, we've also been developing the business case, which ultimately is the costs and the benefits of what we are doing. What are the costs? Well, the costs, we can think of the costs as being the actual costs of data collection on the one hand, but also the costs of poor levels of child well-being across Europe, what the costs are to society. And therefore the benefits quite obviously are how we can have interventions which improve child well-being and actually in the longer term save society a lot of money. So the cost-benefit analysis demonstrates that the GUIDE survey can actually save money across Europe, given the enormous amounts which are spent on social welfare. And of course, we've been doing a lot when it comes to the research design as well. So thinking about the actual processes and contents of the GUIDE study, for which the questionnaire is central. So we have a common questionnaire. This is what we can call an input harmonized survey, where we try to ensure that things are all harmonized from the outset in order to deliver a fully comparable data set at the end. So the questionnaire is developed in English, along with the children, along with the scientists, and along with policymakers. And then it goes through a common translation process so that we try to ensure that the questions are identical within each of the different language groups that we cover. As well as having a common approach to the translation and the questionnaire, we have minimum sampling thresholds within each country and systems so that we ensure that the data which is collected is fully representative in each of those countries. Similarly, we have fieldwork practices which will be identical or similar across the consortium. And because of all of these systems and processes that we put into place, we will be producing a fully comparable data set at the end of the process. A little bit about the structure of what we're doing. On GUIDE, we are going to be following 2 cohorts. We will go into the field in 2027 with an 8-year-old cohort. We will ask the 8-year-olds themselves questions. We will also ask their parents, and we will follow them through to the age of 24. 2 years after that cohort begins, we will start a 9-month-old cohort and follow them up in 2 years, and then subsequently every 3 years until they are 24. So we will have 2 cohorts in the field, understanding how these people's lives develop, how their well-being changes as they grow up, and feeding into policy debates across Europe. And importantly, we will be asking the young people themselves. Now, there's a lot of data out there. There's a lot of government data out there, which can be harvested, can be used through government registries and administrative sources. But what that lacks is the subjective understanding of children's well-being. And so the important thing here is that by talking to people throughout their lives, we understand what their well-being is from their own perspective. That subjective approach to understanding well-being is fundamental to what we do, and it can only be done through direct questioning in the surveys that we are developing.